So Rebecca Roberts, and I can look, I have Rebecca Roberts meds in her drawer. So that's how I remember to check the correct patient. You miss one of these 5 rights on any of the checks, and we'll know it, and you'll have to redo it. So.
We're only doing 5 rights.
You're doing 5 rights. 5 rights 3 times. So Rebecca Roberts, the first medication she is on is digoxin. So now I'm going to be comparing her label here to the MAR. So digoxin 0.25 milligrams, digoxin 0.25 milligrams PO daily. That's what I have. It's an oral form. It expires next year and hasn't been given yet. And I know I can give the digoxin because I'm going to make it up. Her apical pulse is 65. If it was less than 60, I would have to hold this. Okay? You need to acknowledge out loud at some point that digoxin is a special assessment drug that I know what her apical pulse is. We're not playing, games or anything like, oh, well, so that the nursing assistant gave me these, or I'm not sure these are the right vitals, I didn't take them. None of that, okay? Doesn't matter. These are the vitals we give you when they're valid. So, I'm gonna do my first check again, just because I was talking so much. Rebecca Roberts. That's all I have to do. Digoxin, 0.25 milligrams. Digoxin, 0.25 milligrams orally, daily, to be given at 8 o'clock. Hasn't been given yet. Apical pulse is 62 or 65, and expires next year. So that was my first check on that one. The next one is Rebecca Roberts. Lisinopril, 15 milligrams, PO daily at 8 o'clock. I have PO form, and hasn't been given yet and expires next year. The next drug is in a vial, but it's from her drawer, so to help me remember, it's still Rebecca Roberts, and it came from Rebecca Roberts' drawer. The order is heparin, 5,000 units at 0800. It's actually sub-Q every 8 hours. I'm giving it at 0800, hasn't been given yet. That was the order. On hand, I have a vial with heparin, 10,000 units per milliliter, so it's injectable form. I'll be giving it sub-Q and it expires next year. So that was my first, oh, shoot. Forget it, she doesn't have fever. So if she needed Tylenol or acetaminophen or milk of magnesia, that would be a stock med. Like in the nursing homes, they have a big bottle, right. Okay? We ran out. It doesn't have a fever, I heard her. That was my first check. This is my second check. I have Rebecca Roberts. I have digoxin, 0.25 milligrams, PO daily, to be given at 8, hasn't been given yet. I already checked her apical. And what I have on hand is digoxin, 0.25 milligrams. They're in capsules, and it expires next year. There. The next drug.
So when you do your check, you're checking all 5 rights?
Yes. The next drug is Rebecca Roberts. She has lisinopril, 15 milligrams PO daily, 0800, hasn't been given yet. We did take her blood pressure this morning and it's okay. It was 128/76, so I can give it. On hand, I have lisinopril, 15 milligrams in oral form, and it expires next year. And then the next med is heparin. So Rebecca Roberts, heparin, 5,000 units, sub-Q every 12 hours. It's to be given at 8 o'clock this morning, has not yet been given. On hand, I have heparin, 10,000 units per milliliter. It's in injectable form. It expires next year. You only have to say expiration once, but if you just say it every time because you're on a roll, I don't care, because I do it because I don't want to forget. So now I have to do some math. So, do some math.
If it's simple, can you just do it in your head, or do we need to show it?
If you can do it in your head. So what was ordered, 5,000 units? these suck. 5,000 units, and on hand, I have 10,000 units, was it?
Yeah,
Per,
Half a mil.
you have to.
It's really like Russia.
per 1 mil,
That's a little better.
so it's half a mil?
Yeah.
I did that in my head.
Yeah.
Yes.
So, with injectables, I am going to go ahead and prepare that syringe.
You do that on second check.
So after the second check, then you're going to draw up your solution, because then you need to do a third check on it to make sure that you drew up the correct amount.
Right.
So I have I grabbed a 1 milliliter syringe. I could use a 3 milliliter syringe, doesn't matter. And I dropped it, so we can't use it. So I have another one. When stuff drops on the floor, it's dead, don't even touch it until. What size needles shall I use? The sub-Q. 25, 27, 3/8 to 5/8. So I'm giving 0.5, so I pull back to 0.5, and again, you could also use the 3 ml syringe. I'm gonna inject the 0.5 of air, and then pull it back. I overfill it and then push it right back in, because you're always gonna get a bubble. And then pull back slowly. Heparin is one of the high alert drugs. Sounded like a question, it wasn't. Because it is an anticoagulant. And then I scoop the cap back on. And then I would change the needle, only because it's already gone through this rubber stopper. So let's say I change the needle. Now I'm ready for my third check. I have Rebecca Roberts. I have digoxin 0.25 milligrams PO daily at 8 o'clock. Hasn't been given. And on hand, I have Rebecca Roberts, digoxin 0.25 milligrams, capsule form. And I like to pop it up. So these are for a month each, and students usually just pop wherever they want. So these will not be coincide with our current calendar. I would just do the next one. So today's the 14th, and you would pop out number 14. I'm just gonna pop out this little guy down here. And now I can put him back in the drawer. The next medication is Rebecca Roberts. Lisinopril 15 milligrams, PO daily at 8 o'clock, hasn't been given. I have Rebecca Roberts, lisinopril 15 milligrams, capsule form, and I'm gonna pop that one out. I feel like a real nurse.
You are.
And my mother over here, she's so funny. Okay. The third drug is Rebecca Roberts. Even if it's not on the vial, I still have to say Rebecca Roberts. And it's heparin, 5,000 units, sub-Q every 12 hours. I'm giving it at 0800. On hand, I had 10,000 units, did the math, it came out to 0.5 milliliters. And on hand, that's what I had, so I did double check that. It expired next year if I didn't say it. And I'm ready to give that. So that goes here. Then I would put the drawer away. Close the cards. I'm gonna sanitize again. I have left a mess here. And sorry, these are older than you guys. They're older than them. Not us. Okay, so I believe I have everything. If I had garbage can here, I'd clean this all up very nice. Okay, so I'm gonna take my MAR with me. I'm gonna take my meds with me. I feel like I'm forgetting something. I don't think I am. So then, knock, 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 come in. So I'm in the patient's room now. Sanitize my hands, provide privacy. Always forget. Hi, my name is Karen. I'm a student nurse with MATC. I have your morning medication. Can I please check your ID band? Against this, so on their arm, they'll have an ID band and you'll say, oh, Rebecca Roberts. Can you spell your last name? Tell me your date of birth, 6/18/62. Okay, real good. So then I explain what they're getting. And you need to do, it's very basic, but you need to do it. I would not explain after they've swallowed the pill, because then if you're going through side effects, it's already in their tummy, you're like, oh yeah, by the way, it could cause, they don't. So, the first medication I have for you today is digoxin. Digoxin is for your heart failure, and what it does is strengthens the contraction of your heart, so it pumps more efficiently, and by doing that, it lowers your heart rate. We checked your apical pulse this morning, and it was 65, so I can go ahead and give it. It can cause, and I don't remember all the side effects, it can cause some, it could cause nausea and vomiting. If it does, you need to call and let me know right away. In some cases, it can cause halos around the lights. You can see like yellow or green halos. That's something that you need to report right away. And then honestly, I can't remember the other side effects. So it can lower, obviously it can lower their heart rate. If it lowers their heart rate, maybe they could get a little woozy when they stood up. The next medication is lisinopril. This is for your high blood pressure. Your blood pressure this morning was in a good range, and so I can go ahead and give it to you. This one can cause a little dizziness when you stand up, a little lightheadedness, so I'd like you to put your call light on before you get up. And then the next one is your heparin. So heparin is an injection. It goes into your abdomen, and you get this every 12 hours. And what it does is it helps to prevent blood clots. And because you've just had surgery, and you're not getting up and moving around like you usually do, it could put you at risk for blood clots. So the doctor has ordered this for you. Some people call it a blood thinner, because that's what most lay people know it as. Do you have any questions about that? No? Okay. And then you go to the pills first, or whatever. And so I'm going to give her her injection. So remember, for a sub-Q, you would show us all of the sites. So back of the arms, abdomen 2 inches away from the umbilicus, anterior thigh, upper outer hip, and then below the scapula. However, abdomen is almost always given in the abdomen. Heparin is always given in the abdomen, unless for some reason you cannot.
And the body's the legs.
Probably, yeah, I think so. But just always remember heparin abdomen. So remember what we do. So what you're going to do is, you would palpate the site. So actually, we're going to be injecting in here. Palpate the site, make sure there's no lumps, bumps, scars, anything like that. You're going to clean the site off. Start in the center, go outward. I just leave that there so you can use it for counter pressure. Take the cap off, scoop up. 90-degree, anchor, give it. This is the one we were supposed to hold it for like 30 seconds.
Yeah.
Right.
Good luck.
You can't even read my lips, but no way. Then sharps. Where are the sharps? Okay. And then I'll have a mannequin who's sitting up. I don't have any water. I did not go prepared today. So she's sitting up, and I'll say, can you just take a sip of water for me? How did it, any problem swallowing that? No. And then I can go ahead. Do you want your pills one at a time or all together? All together. So she's sitting up. Here's your meds. Here's some water. Did they go down okay? All right, fine. Here is your call light. I'll be back in about 30 minutes, see how you're doing. And in the meantime, if you need something, push the call light. I would clean up my mess here, go back to the nurse's station, and then document. That's it.